Okay, so now for part two. For the last section, so we have medical and wellness approach. So we have music therapy and wellness, neurologic music therapy, and biomedical theory of music therapy. So music therapy and wellness. So it supports health promotion and prevention. So it's not just about treatment, and it's also holistic. There's an emphasis in balance, stress reduction, creativity, and community. According to AMTA, so the specialized use of music to enhance quality of life, maximize well being and potential, and increase self awareness in individuals seeking music therapy services. So that's how they define music therapy and wellness. And of course, wellness programs differ in each population from education, corporate, and to older adults. The Health Rhythms Division develops and provides materials, programs, training, and the latest research supporting the use of drumming as an effective means for promoting and maintaining health and well-being. So the common steps like group music making, like drum circles, choirs, mindfulness or guided relaxation with music, or recreational singing and playing instruments for joy. In recreational music making protocol, so they did 6 sessions, or even like a single session of group drumming can have an effect. As for older adults, they used 5 sessions or like weekly, basta it's 1 hour each session. So in corporate settings, so it's more on increasing awareness of the importance of good health, decrease stress, self-awareness and self-responsibility to increase overall profit for companies, their productivity, increase job satisfaction, reduce absenteeism basically. For schools, it's more on helping them be aware of the long-term impact for their health related decisions and the importance of having a healthy lifestyle. And then for the goals, it's more on gain and prolong attention, structure and activity, music serve as a cue, and improve recall, enhance learning, retain learned wellness information longer, increase positive social interaction, communication, and cooperation. And then you can also do musical hobbies to provide emotional outlet and a refreshing break from the regular routine. As for older adults, it's more on personal safety, socialization, intellectual stimulation, screening for depression, interpersonal support, physical fitness, stress management, self actualization, spiritual development. So, music can increase enjoyment of exercise, enhance motivation, help structure movement, also affect mood and mental states, and may provide opportunity for emotional expression and catharsis. On to the next, NMT. So it's developed by Michael Thought. Grounded in neuroscience, music directly stimulates brain function via rhythmic and melodic elements. So it is based on RSMM, Rational Scientific Mediating Model, which describes the reciprocal relationship between musical behavior and brain function. So it applies like to cognitive, sensory, motor dysfunctions due to neurologic disease, and then the transformation design model, where you know that. So we also have the 4 essential paradigms here. We have the neuroscience guided rehabilitation, which integrates evidence-based output from brain research and clinical studies, and then learning and training models, which illustrate how rhythmic motor learning and training functions in relationship to temporal structure and organization to enhance cognitive, speech, and language functioning, cortical plasticity models, which incorporate music as a complex but organized diverse sound structure that drives neural patterns. And then lastly, the neurological facilitation models, which describe how pattern sensory input enhance both motor and cognitive functions. For sensory motor, we have RAS, rhythmic auditory stimulation, so uses music as a cue to regulate body's movement in time. So this is good for gait. So we have a 3-step process. We have pre-gait exercise, so by moving forward or backward, like weight transfers, or side to side while standing between parallel bars, including seated exercises like knee extensions, marching, and then after that we do the gait training. So you have the initial gait training, the assessment, and then the resonant frequency entrainment, frequency modulation, fading, and then try to reassess, and then of course the advanced gait training. For the terms, we have cadence, number of steps per minute, velocity, number of meters per minute, and stride length is the velocity divided by cadence times 2. And then PSE, pattern sensory enhancement, so we use rhythmic, melodic, harmonic, and dynamic acoustical elements of music to provide temporal, spatial, and force patterns to structure and cue functional movements like grasping, lifting an object, flexion and extension, and then lastly, temp, therapeutic instrumental music playing. So the use of musical instrument playing to facilitate engagement in physical exercise and stimulate functional movement patterns. For speech language communication, we have MIT melodic intonation therapy. So it is used to stimulate language, especially for expressive aphasia. You do speech singing followed by a spoken phrase produced with normal speech characteristics. For individuals who have suffered damage to the Broca's area of the brain, it is good for children with developmental apraxia of speech. Next is Mr. Musical Speech Stimulation. It produces non-propositional speech in persons who have aphasia. So you do fill in the blanks. And then RSC, rhythmic speech cueing. So it is beneficial for apraxia, dysarthria, and fluency disorders. So it uses rhythmic cues to control the rate of speech and speech initiation. And then VIT, or vocal intonation training. So it uses elements of vocal control, inflection, pitch, breath control, timbre, and loudness. So it is different from MIT, and it's used to enhance functional speech affected by speech disorders, not to initially develop speech. And then the song phrases are faded to spoken phrases. And the next is TS, therapeutic singing. So it facilitates rehabilitation using singing to initiate and develop speech, improve articulation, and increase respiratory function. We also have OMREX, oral, motor, and respiratory exercise. So they use musical wind instrument playing and oral exercise performances to achieve better sound vocalization, improved articulation, increased respiratory strength, and better speech mechanism function. Next, we have developmental speech and language training through music, DSLM, to develop initial speech and language. So we use this one through singing, chanting, playing musical instruments in combination of music, speech, and movement. And then lastly is SICOM, symbolic communication training through music. So to achieve behaviors inherent in communication, so we use structured musical performances and or improvisational music performances. For the cognitive domain, we have a subcategory, the auditory attention and perception training. So we have MSOT, musical sensory orientation training. So this is for severe to profound developmental disabilities or those who are comatose. So it's used for arousal orientation. And then musical neglect training. So it focuses on attention in the neglected or unattended visual field for clients with one-sided sensory weakness. And then APT, auditory perception training, used to discriminate sounds and integrate sensory stimuli. Lastly, we have MACT, musical attention control training for active or receptive participation. So we have different types of attention selectively, so you can focus on a single sensory source and ignore others. Sustained, you can maintain focus of attention and increase the duration of attention focus for progressively longer periods. And then divided, focusing in two different sensory sources simultaneously, and then alternating is basically shifting from one to another. And then the second subcategory is memory training. For MMT, or musical mnemonics training, this is for memory encoding and decoding or recalling functions. So different types of mnemonic exercise. First is echoing, so immediate recall. Procedural, basically step. Declarative is semantic and episodic. So for memory skills, it's more on analyzing and remember the content of the song, for example. And then AMMT, associative mood and memory training. So mood likely facilitates or evoke recall and memory. So it's used to induce a positive mood or emotional state conducive for learning and recall. Another category is executive function training. So we have MEFT, musical executive function training, can be group or individual, using improvisation or composition targeting EF like organization, problem solving, decision making, reasoning and comprehension. And then lastly, psychosocial behavior training. They use MPC, music, psychotherapy, and counseling. So use music to induce and change moods, cognitive reorientation, train affective behavior response, social skills, and musical and incentive training for behavior modification. Down to the last one, biomedical theory of music therapy. So basically, it describes how music directly affects biological systems like heart rate, respiratory, and all that. and then provide scientific foundation for physiological effects of music. So here, brain is the basic domain of treatment and primary focus for change in all music therapy application. We also have sensory integration, so this is the process by which the nervous system receives and organizes tactile, proprioceptive, vestibular, olfactory, gustatory, visual, and auditory sensations, and then the cortisol levels, so these can help us identify stress levels. 5 principles of biomedical theory of music therapy. First, music influences human behavior by affecting the brain and other bodily structures in ways that are observable, identifiable, measurable, and predictable, thereby providing the necessary foundation for its use in treatment procedures. Second, because the final relay station in the normal auditory pathway is in the thalamus, this allows music to immediately affect the hypothalamus, which works closely with the limbic system in controlling emotional behavior. Third, active participation in expressive musical activities provides structured movement behaviors necessary for maintenance or recovery of physical function and for development of the skills necessary for interpersonal communication. Fourth, use of music to induce relaxation. So music has a direct effect on specific physiological processes whose functional variations are indicators of anxiety, tension, or stress. And lastly, the role of music in facilitating use and development of cognitive capabilities in the human brain. Musical perception and participation require the brain to organize incoming stimuli and to plan and execute corresponding behavior, thereby enhancing perceptual ability, cognitive processing, and interactive response capability. Okay, so now we're here. The methods and materials and improvisation. Facets of music experiences, we already know this: physical, emotional, mental, relational, social, so it can be inter and intra, and then spiritual, so form can be peak, transpersonal, or transcendent. As for the terms, method, so it is a particular type of experience used for assessment, treatment, or evaluation. So we have different types. We have 4: improvising, recreating, composition, and listening. And the first 3 are called active methods, and then the last one is receptive. Then model, to compare it, so it is more on approach, includes theoretical concepts, clinical indication, goals and objectives, guidelines for implementation and such. And then procedure, basically the sum total of organized sequence of steps. And then technique are in the moment actions of the therapist used to shape the immediate experience of the clients. For the different methods, we have receptive, so clients listen to music and respond to the experience silently, verbally, or in another modality. So this is best for clients with attentional abilities and receptivity needed to take in the music and who will benefit therapeutically from responding to the music in a particular way. And then for sample goals, these are sample goals: promote receptivity, evoke specific body responses, stimulate or relax the person, develop auditory motor skills, evoke affective states and experiences, explore ideas and thoughts of others, facilitate memory, reminiscence and regression, evoke imagery and fantasies, connect a listener to a community, stimulate peak and spiritual experiences. 4 variations in receptive, we have somatic listening. So this is the use of vibrations, sounds, and music in various elemental and combined forms to directly influence the client's body and its relationship to other facets of the client. So subtypes: entrainment, so synchronicity; resonance or toning, so based on vibrations; vibroacoustic music, so this is vibration plus the application of vibrational patterns of music directly to the client's body, like musical acupuncture. And then music by feedback, so these are moment-to-moment auditory feedback on autonomic body functions like heart rate, blood pressure. And then music for pain management, relaxation, meditative listening, subliminal, so this is to mask the delivery of subliminal verbal messages or suggestions to the unconscious mind. And then rhythmic listening, rhythmically organized and monitor motor behaviors. Perceptual, so this is to improve auditory attention, perception, discrimination, conservation. And then active, so this is used to elicit specific behavioral response. We also have contingent listening, so contingent reinforcement for behavior change. Mediational, so this is for learning and recalling information. Music appreciation activities, song reminiscence, song regression, so to re-experience the past, then induce song recall, to induce consciously and unconsciously, song for communication, so asking the client to select and play a song which expresses or discloses personal experiences to the client and is relevant to therapy, song discussion, or lyric analysis here, projective listening, so the therapist present a sound or music and ask the client to identify, describe, interpret, or free associate them through either verbal or non-verbal means. So we have different techniques of that. Projective sound identification, so the client listens to ambiguous sounds and identifies what they are, or free association, or projective storytelling, music dramatization, so they act out what they hear, and then further song choices. We also have projective movement to music and drawing to music. Next is imaginal listening, so this is to evoke and support imaginal processes or inner experiences, often while in a non-ordinary state of consciousness. We have different types. The directed music imaging, so the clients image what the therapist presents when listening to the music, usually in an altered state of consciousness. The images may be selected by the therapist or the client, may be mental or physical in nature. The image may be specific as well, or personalized or general, and the therapist's guiding may be spaced at various intervals. And then unguided music imaging, guided music imaging, so freely images the music while in altered state of consciousness and dialoguing with the therapist. And then guided interactive music imaging, so the client co-create images to music with other clients under the guidance of the therapist. And lastly, self-listening, so they listen to their own recording, their own improvisation, performance, or composition to reflect upon oneself and the experience. Next method is recreative, so recreating music that already exists and try to personalize it. So primary candidates, those clients who need structure to develop specific skills and role behaviors, as well as to clients who need to understand and adapt to the ideas and feelings of others while still retaining their own identity, as well as clients who need to work with others towards common goals. The example goals: develop sensory motor skills, foster adaptive, time-ordered behavior, improve attention and reality orientation, memory skills, develop an ability to hear and monitor oneself, prompt identification and empathy with others, experience and release feelings within a safe and appropriate medium, develop skills in perceiving, interpreting, and communication ideas and feelings, and lastly, learn specific role behaviors in various interpersonal situations. Some goals include improve interactional and group skills, develop a sense of community, and identify with the value or belief of a group, community, or culture. And then for variation, we have instrumental recreation or playing an instrument. So this is a reproduction of structured or pre-composed music materials using a musical instrument. So others include vocal recreation, games and activities such as name the tune, musical bingo, and parachute activities. Next method is composition, so the process where the therapist supports the client in creating their own music or lyrics. Could be in the moment, or develop from previously improvised ideas, or completely on their own. Sample goals include develop the ability to document and communicate a way for others to recreate the composition, promote the exploration of therapeutic themes through lyrics, and develop the ability to integrate and synthesize parts into the whole. For variation, you can do song transformation or lyric substitution, songwriting, song collage, instrumental composition, notational activities. For songwriting strategies, we have fill in the blanks, collage, parodies, Mad Libs. So these is similar to fill in the blanks, except the therapist asks for a kind of word, could be noun, verb, or feeling, instead of letting the client see the context of the lyrics and original songs. For the last method, we have improvisation. So freely singing, playing, creating melodies, rhythms, and songs. Could be instrumental as well. So basically, it's spontaneous music making. Sample goals: establish a nonverbal channel of communication and a bridge to verbal communication, fulfilling a means of self-expression and identity formation, exploring various aspects of self in relation to others, identify, express, and work through difficult emotions, develop the capacity for interpersonal respect and intimacy, develop interpersonal or group skills, interpersonal or group problems, resolving it, develop creativity, expressive freedom, spontaneity, and playfulness within various degrees of structure, stimulate and develop the senses, and develop perceptual and cognitive skills. For variation, we have non-referential or free improvisation, can be solo, duet, group, and then referential. We have two different types of reference: static, so sound music or music does not change over time, like sleepy time, calm, and then dynamic, so there's musical movement, so like for example, typical day or storm. Then for dynamic, we have subtype, continuum referent, like for example, and anxious to calm, so going somewhere. And then song improvisation extemporizes lyrics, melody, or accompaniment. And then vocal non-referential improv, so extemporizes vocal piece without words or images. And then body improvisation, so more in percussive body sounds. Then mixed media improvisation improvises using voice, body sounds, instruments, or any combination of sound sources. And then conducted improvisation, so the client creates an improvisation by giving directive cues to one or more improvisers. Now to differentiate clinical improvisation to music improvisation, so in clinical there is purpose, so for like could be assessment, treatment, or evaluation. And then music improvisation is more on creating music, often to produce a musical product of aesthetic and no processing after. Now let's learn some terms. Percussion-based improvisation, so they use percussive sounds like with mallet, strikers, shakers, and scrapers. Could be tonal based, so using melodies or harmonies and tonal instruments. And then givens, these are parameter. This is a parameter considered a structure, a limit, or consideration for the improvisation. And then play rules, so these describe the concept of givens. So there are different types. Vocabulary givens, the number or sorts of sounds that may be used, including what instruments. Procedural givens, so this is the improvisation procedure, like guiding the timing, sequence, or length. And then interpersonal givens, so this is to specify the types of relationships that are created between the players, either prior to the improvisation or as it unfolds. And then drum circles, so this is a rhythm-based event, tool for unity for social and recreational aims, non-referential, and the facilitator is not technically an MTBC. Catharsis, this is the process of releasing and providing relief from conscious or unconscious repressed feelings. So the resulting product of cathartic expression is called expressive sound form. Next is instrumentarium, so this is a collection of percussion and tonal instruments. And then to note, before launching the first rhythmic exercise, strive toward ambidexterity. Number of instruments could be 1.5 to 2 instruments per player. When selecting instruments, make them age-appropriate and adapt to clients' needs, goals, and objectives. Now we have sound vocabulary, so this is a 6-step procedure. First, pick up an instrument and announce what it's called. Share a bit of information like its origin, history, conventional role, and then demonstrate or describe conventional ways to sound the instrument, and then demonstrate at least 2 unconventional ways to play it, and then ask for volunteers or pass the instrument around the group. And then once all of the instruments have been introduced, instruct the client to spend a few moments to sound and explore, and then invite them to return to their seats once they have a choice in mind. When presenting the sound vocabulary, use language that is easy to understand. Stress that authentic self-expression is the highest order of playing. When modeling, use both rhythmic and non-rhythmic examples, and then try to incorporate variety of dynamics, numbers, and playing configurations to your playing so that they can hear and see various possibilities. Then avoid putting emotional labels on certain sounds and judging the value of certain sounds. Be careful not to play in a showy manner, and consider the attributes of the players. Children need fewer words and more modeling. As for older adults, they may require slower pace. Now let's learn some terms. Prosody, so this is a pattern of intonation. Rhythmic ostinato, a repeating and persistent rhythmic pattern. Vamp, this is a repetitive harmonic pattern. Figure ground, so this is on top of the grounding beat. Tessitura, general highness or lowness of a part, can be applied to non-pitched instrument. And then perseverating, engaging in non-purposeful repetitive actions or acting in injurious manner. The need for structure in improvisation is for predictability, logic, equality, cohesion, and meaning. For structure, first we do introductory discussion, verbal check-in, which is optional, sound vocabulary, warm-up improvisation, brief discussion, core improvisation experience, verbal processing, and verbal or musical closure. As for facilitation skills, first is empathy, so these are in-the-moment actions. You can do imitating, echoing some aspect they played after they played it, and then synchronizing is doing what the client does as the client is doing it. It can be mirroring, so it's synchrony of action in reverse direction, and then incorporating, borrowing a motif and integrate it, pacing, matching the client's level, reflecting, expressing the same mood as they expresses it. The next is structuring, could be rhythmic grounding or tonal centering, and then elicitation techniques could be repeating, the motif repeated to elicit a response or establish a mood, modeling, the therapist demonstrates, making spaces, making use of silences, and then interjecting, which is the opposite of making spaces, so you add in between. For redirection techniques, you can do introducing change, differentiating, modulating, intensifying, and then intimacy techniques. It could be sharing instruments, bonding, so the development of musical theme that represents therapeutic relationship. Sulikukoi, I don't know if I said it correctly. So it's improvises as if talking to himself about the client. Then procedural techniques are receding, so the therapist pulls back or withdraws. And then referential techniques, basically free associating. So in listening set, this is the sum total of the contextual information and biases with which you enter the improvisational process. Emotional exploration techniques could be holding, so this is containing a musical background that reverberates clients' feelings while offering musical structure for containing the release. Then doubling, the therapist or peer serves as a double for the client. Contrasting, the therapist directs clients to sequentially explore divergent qualities or feelings. Then splitting, both simultaneously or alternately, improvises the good and then the bad. And then transferring, the therapist and client assume specific roles to help client explore. They also made improvisation assessment profiles or IAPs, AIPs. Can be intramusical and intermusical relationships. So the first 5 profiles, first one is salience. So this is the most noticeable or important. And the continuum of prominence could be receding, overpowering, conforming, contributing, or controlling. And the next is integration, the rhythmic or tonal figure ground. The vertical sound. Then gradient could be undifferentiated, over-differentiated, fused, integrated, or differentiated. Then variability, this is the horizontal sound, so there could be a change or lack of change over time. It could be rigid, stable, variable, contrasting, or random. And then tension, this is the degree of rhythmic, tonal, or expressive tension. It could be hypotense, calm, cyclic, tense, hypertense. And then congruence, so this is the agreement or harmony of all factors. It could be uncommitted, congruent, centered, incongruent, or polarized. And they also add autonomy, freedom from external control or influence, be dependent, follower, partner, leader, or assister. So these assessment tools and in-the-moment listening guides are designed to help us recognize tendencies over time. So this is what it looks like. You can just pause and read as well. Now for the last part, verbal processing. Not all models involve verbal processing because they can be processed through other modalities like Mandela art, movement, writing, and role-playing. Decisions about VP or verbal processing are also linked to therapeutic aims. It can be periodic, focused discussion about improvisation processes, and products can assist you in your evaluation, so the role of therapist can be non-directive or directive. As for verbal techniques, first is probe. This is used to elicit a descriptive and sometimes detailed verbal response in an open-ended way, like what were your reactions to the very end of the improvisation? Avoid did you, were you, have you, why. Use how did you, when have you, why were you, but with caution. Reflection of feeling. This is a technique of empathy, matching the underlying emotional character of the client's action. And then clarification. So this is used to clear up confusion. I want to be sure that I understand you. Are you saying that? Blah, blah, blah. And then checking out. Responding to a therapist's internal hunch about what has been said or has been not said. So this is different from clarification. And then self-disclosure, the therapist shares personal information And then summary serves 4 main functions in clinical sessions, affords opportunity to highlight sequential action, identify main themes to have emerged, opportunity for client to discuss their final reactions to the session, and appropriate time to look ahead to the next session or perhaps make decision about what will occur or goals will be addressed. And these are some examples, so you can read it. And that's it. Thank you so much for listening. I hope you learned something, and then see you in the next video.